Thank you so much for the opportunity to present. I'll be presenting our study on retinal microvascular changes in non-diabetic chronic kidney disease on hemodialysis. It's an octa-based study. So, what is CKD? CKD is defined as kidney damage with glomerular filtration rate less than 60 milliliters per minute per 1.73 meters square for 3 months or more, irrespective of the cause. The leading cause of CKD in India is diabetic nephropathy. The retinal changes in CKD include decreased retinal vessel caliber, focal arteriolar narrowing, AV nicking, and opacification of the arteriolar wall. These changes are expected in hypertensive retinopathy, and most patients of CKD have hypertensive retinopathy. So, stage 5 CKD, as per the KIDGO classification, is defined as GFR less than 15 milliliters per minute. In our study, the aim is to analyze the octa changes in the retinal microvasculature in non-diabetic stage 5 CKD patients undergoing regular hemodialysis versus age-matched healthy controls. So via octa, we studied the superficial vascular plexus, the deep vascular plexus, the choriocapillary layer, and the FAZ area. It is a prospective single-center cross-sectional observational study conducted between December 2020 and June 2021. The sample size of 60 eyes, that is 33 patients in the CKD group, and 60 eyes, 30 patients in the control group was determined. The inclusion criteria in the CKD group included age greater than or equal to 21 years, and the patient had to be non-diabetic stage 5 CKD diagnosed by a nephrologist and had to undergo regular hemodialysis of at least 12 hours weekly in 3 divided sessions. And the machine used was the Fresenius 4008S machine. And the exclusion criteria was diabetic CKD patients, any patients with presence of significant ocular media opacity such as cataract, and any pre-existing macular pathology or inability to obtain an adequate quality octa and OCT image, and pregnant patients. Coming to data collection, all participants of the study underwent a complete ocular exam, including vision, refraction, fundus exam, fundus photography, and swept source OCT and octa imaging on the DRI Triton Plus machine. And octa scans of 4.5 into 4.5 milliliters centered on the fovea were captured. In this image here, we can see the red areas are the vessel areas and the blue areas are the non-vessel areas. And in the center, we can see the FAZ. So the vessel and non-vessel areas were quantified using local fractal analysis technique, and MedCalc statistical software was used for doing the statistics, and all vascular parameters such as the SVP, DVP, choriocapillaris, vessel density, and the FAZ area were expressed as median and 95% confidence intervals, and Kruskal-Wallis test was used to compare the vascular parameters between the CKD and the control group. A p-value of less than 0.05 was statistically significant. So coming to the results and observation, we see that there were more males than females in both of the study groups, and the mean age in the CKD group was 44 years, whereas in the control group it was 49.5 years. And the etiology of CKD was diverse in our study population, the most common etiology being chronic glomerulonephritis, that is 28 out of the 33 patients. Within CGN, the commonest cause was hypertensive nephrosclerosis, and the second common cause was idiopathic etiology. Then all 33 patients in the CKD group had hypertension as a comorbidity. And coming to the vision, so 97% of the patients in the CKD group had a vision of 6/6, and only 2 patients had 6/9 vision. So all of them were visually asymptomatic and had good visual acuity, whereas control groups, all patients had 6/6 BCVA. We also analyzed the 45-degree central color fundus photographs of all 60 eyes of the CKD group and graded as per the Keith-Wagner-Barker classification, and found that 43% of the eyes had no evidence of hypertensive retinopathy clinically, whereas 57% had some degree of hypertensive retinopathy. Here we have an image of a patient with grade 3 hypertensive retinopathy with vein occlusion. So out of the 60 eyes that we took in the CKD group, the octa images of 23 eyes were not clear enough owing to various octa artifacts, and these scans were ineffective for fractal analysis and quantification of vascular parameters. Hence we excluded those, and only 37 eyes the octa images were taken and compared with 40 eyes in the control group. Coming to the outcomes, in the superficial vascular plexus, we can see here in the CKD group and the control group, there was a significant difference in the vessel density in the CKD versus the control group. The CKD group, we can see there is altered FAZ, there is reduced vessel density and capillary rarefaction present. The red areas indicate areas of blood flow, and the blue indicates avascular regions. The p-value was significant, so less than 0.01. Similar changes were there in the deep vascular plexus. We can see there is reduced vessel density, altered FAZ, and capillary rarefaction. it was this in the DVP also there was significant difference. Coming to the FAZ area, it was not significantly different between the CKD and control groups, neither in the superficial layer nor in the deep layer. And then we moved on to the choriocapillaris layer. So we took octa images of the choriocapillary layer from the Brooks membrane to 20 micrometers into the choroid, and there was attenuation of vessels in the choriocapillaris in all of the patients. However, this could not be used for quantification of vascular parameters, hence we decided to take a segment from the deeper choroid from 60 to 80 micrometers, and that showed a significant difference of P less than 0.01. So our study found that the SVP and DVP vessel densities were significantly lesser. There was choriocapillary attenuation in the CKD group. The choroidal vessel densities were significantly lesser. There was altered FAZ. And in our study, we excluded the diabetic etiology of microvascular alterations so as not to have any confounding factors. And so as to more closely explore the pathology that's present in CKD and hypertensive retinopathy. Concluding,
Yeah, you can just finish it.
Okay, so what we found in the eye is that these microvascular alterations are also present in other areas such as the brain, heart and kidneys, and this is the main principal pathogenic factor in development of severe organ dysfunction in CKDs, and octa can be used as a tool to prognosticate and document these changes before visual symptoms develop. Thank you.
Good, thank you, nice presentation. Well, thank you.
It's okay.
Discuss much on this.
It's okay. Understand. Thank you.
Excuse me. So how does the CKD cause these changes or the hypertension?
Yes, so I think it's the hypertension as well as the uremic status and the volume overload because of end-stage renal failure.
So the study would have been better if you had taken hypertensive patients without CKD and CKD patients with hypertension.
Yes, sir. That would
have
another
been
study.
better study, I think.
Yes.
Anyway, thank you very much.